Hello everyone. In this video we will take you through the steps for using Zotide injection. Zotide contains teriparatide, which is used for the treatment of patients with severe osteoporosis. Your Zotide comes with the Zotide cartridge, pen and pen needles. The Zotide cartridge contains 750 micrograms teriparatide per 3 ml, which is used as 28 days therapy. The Zotide pen needle box comes with 30 sterile single-use needles. Use a fresh needle for each injection. The Zotide delivery device pen is to be used with Zotide cartridge and pen needles only and is not intended for any other drug delivery purpose. The Zotide pen consists of thumb button, dose dialer, dose window, cartridge holder. Steps for assembling the Zotide pen are as follows. Wash your hands well with soap and dry them with a clean towel. Holding the pen injector with one hand, remove the pen cap by pulling it off with the other hand. Rotate the cartridge holder to separate it from the pen body. Insert the cartridge metal cap first into the cartridge holder. Reattach the pen's body onto the cartridge holder and fix it firmly by rotating it. Now, your Zotide delivery device pen is ready for use. When not in use, refrigerate at 2 to 8 degrees Celsius. Now let us understand how to inject Zotide. Wash your hands well with soap and dry them with a clean towel. Remove the Zotide pen from the refrigerator. Remove the pen cap by pulling it off. Look at the Zotide medicine in the cartridge. It should be clear and colorless, and it should not have particles in it. If it is not clear and colorless, or if it has particles, do not use it. Use an alcohol swab to wipe the rubber seal on the open end of the pen. Always use a new needle for each injection. Pull off the paper cover from the outer needle shield and throw the paper cover away. Holding the cartridge holder, attach the capped needle to the end of the pen by pushing it on to the rubber seal and rotating it. Do not over tighten the needle since it must be removed after the injection. Hold the pen with the needle pointing up and remove the outer needle shield. Keep the outer needle shield because you will need it to remove the needle after administering the drug. Pull off the inner needle shield and throw it away. The Zotide pen must be primed before every injection. You must prime the pen to make sure that the medicine is flowing and that you are receiving the correct dose. Priming removes air bubbles that might affect the dose you get. Small air bubbles may collect in the Zotide cartridge during normal use. A small air bubble may stay in the cartridge when you finish the priming step. If you have primed the pen, this small air bubble will not harm you or affect the Zotide dose. The very small amount of the prime dose does not affect the total supply of 28 days of therapy that the pen will deliver. To prime the pen, turn the dose dialer clockwise until the number 2 appears in the dose window. With the arrow and the number 2 in the dose window in line, hold your pen with the needle pointing up. Tap the clear cartridge holder gently with your fingers so that any air bubbles collect near the top. Using your thumb if possible, push in the thumb button all the way and keep pressing. Continue to hold the thumb button firmly and count slowly to 5. You should see either a few drops or a tiny stream of Zotide come out of the tip of the needle. If it has stopped, this step is complete. If not, the pen needs to be primed again by repeating the above step. Turn the dose dialer clockwise to the right until you see the arrow and number 8 in the dose window. When the number 8 and arrow are in line, you have set the 20 microgram dose and the pen is ready to inject. If you dial too far by mistake, dial backwards anti-clockwise to correct the error. Do not press the button to readjust the dose. Zotide can be injected in the thighs and the abdomen. Prepare your skin for the injection as instructed by a doctor Lightly hold a fold of skin and push the needle straight into it. Inject Zotide by using your thumb, if possible, to push in the blue injection button, thumb button, fully. Continue to hold down the thumb button firmly and count slowly to 5 to ensure that the Zotide has been completely injected into the skin. Remove the needle from your skin when you finish counting. When the injection is complete, you must see the number 0 and arrow in a line in the dose window. This tells you that the thumb button has been pushed in all the way and your full dose has been injected. Cap the needle carefully using the outer needle shield by pushing it firmly over the needle. Remove the capped needle by turning it counterclockwise to the left. Place the used needle in a puncture-resistant disposable container and properly throw it away as directed by your doctor. Do not store or throw away the pen with the needle attached. Storing the pen with the needle attached may let Zotide leak from the pen and air bubbles can form in the cartridge. Replace the cap on the pen. Store your Zotide pen in the refrigerator at 2 to 8 degrees Celsius at all times. You should inject Zotide right after you take the pen out of the refrigerator. Put the pen back into the refrigerator right after use. You can use your Zotide cartridge for up to 28 days, including the first injection. After 28 days, throw away the cartridge even if it is not completely empty. Never share your Zotide pen and needles. Do not freeze the Zotide pen. Do not use Zotide if it has been frozen. For any more queries, kindly consult your doctor.